Hey everyone, and welcome to This Explainer. Look, if you're a modern clinician or a researcher, you absolutely know the struggle. You are constantly fighting this losing battle against information overload. Every single time you open your laptop, it's like a mountain of new data is just staring back at you. And finding the time to actually read it, process it, and apply it, well, it feels downright impossible most days. But what if you could take back control of your time? Today, we're going to look at how artificial intelligence can totally transform the way you read medical journals. Okay, let's dive right in. Here's our roadmap for today. First, we'll talk about the very real problem of drowning in medical data. Second, ethics in the AI era. Third, we'll introduce 4 AI research assistants. Fourth, how to spot AI hallucinations. And finally, we'll bring it all together with the 40-minute AI workflow.
All right, part 1, drowning in medical data, or as I like to call it, extreme information overload.
1,200. That is the staggering number of new papers that are published almost every single time you open PubMed. To put that into perspective for you, it's literally like trying to read a brand new novel every single day. Yet the average clinician? You've only got about 30 to 60 minutes per week to actually sit down and read the latest updates. That mathematical mismatch is exactly why so many doctors are feeling completely burnt out when it comes to staying current.
Because of this massive time crunch, we kind of fall into a trap, right? Out of sheer desperation, the old way relies on just skimming abstracts. We read the title, we see it says a drug improved mortality, we look at how prestigious the journal is, and we stop there. We skip the methodology completely. And guys, this is dangerous. We might end up applying an underpowered or unblinded study to our actual patients. The new way, though, it uses AI as this high-speed research assistant. It allows for deep reading of methodologies and real data verification in a fraction of the time, which ultimately leads to much more confident clinical decisions. Moving right along to Section 2, Ethics in the AI Era. This is all about maintaining academic integrity.
Bioethics experts like Dr. Russell D'Souza warn us about some major ethical pitfalls in modern publishing. We're talking plagiarism, data fabrication, and something called salami slicing, which is basically breaking one single study into multiple duplicate publications just to boost a citation count. When we introduce AI into this messy mix, we have to remember one golden rule. AI should never, ever be listed as an author. AI has zero accountability, it can't take responsibility for clinical outcomes, and it definitely can't take the fall for fabricated data. At the end of the day, the human doctor is always the final intellectual owner.
Section 3, 4 AI research assistants. It is time to build your toolkit.
You know, AI isn't just one big, all-knowing search engine. It's actually a suite of highly specialized tools. Think of Alan.ai as your clinical guideline guru. Then you have Consensus, which acts as this massive yes or no meta-analysis engine. Elicit is your data extraction powerhouse for digging into methodology. And NotebookLM, that's your deep synthesis engine for cross-referencing multiple PDFs and even generating custom study guides. Let's actually look at Consensus in action. If you ask a standard search engine if, say, pembrolizumab in non-small cell lung cancer is beneficial, you might find 3 positive papers and completely miss the negative ones. But if you ask Consensus, it instantly scans millions of papers, pulls the top 80, and gives you a crystal clear breakdown. 83% of the literature finds it beneficial, 11% is mixed, and 6% is negative. In literally 2 minutes, you get the complete flavor of the clinical landscape without missing those crucial negative trials. It's a total game changer. Now, let's keep this core maxim in mind. Conclusions sell papers, but methods reveal the truth. This hits the nail on the head, and it's exactly why we need tools like Elicit and NotebookLM. We can't just rely on an AI to quickly summarize an abstract. No way. We need AI to really dig into the methods, to extract the sample size, the blinding status, and the primary endpoints.
Which brings us to a really cool advanced insider trick called meta prompting. Let's say you upload 15 incredibly complex medical guidelines into NotebookLM, but you aren't quite sure how to ask it for the best summary. Meta prompting means you go over to ChatGPT and ask it to write the perfect, highly detailed prompt. You then take that generated prompt, bring it back, and paste it into NotebookLM. Suddenly, the AI is spitting out instant, perfectly structured clinical study guides, memory tricks, and Viva questions that you probably never would have even thought to ask for yourself.
All right, Section 4, Spotting AI Hallucinations. We need to talk about AI boundaries. Here is a paramount truth that we cannot ignore. Hallucination is not a bug. It is a fundamental property of how these large language models operate. They are built to predict text, not to check facts. Even in top-tier, highly reputed journals, AI has generated fake citations, modified graphical skills, and completely fabricated clinical trial results out of thin air. So, human oversight? It is absolutely non-negotiable.
So how do you actually spot these hallucinations? Well, you got to look out for some specific red flags. First off, real clinical data is messy. You almost never see perfectly round numbers. So if an AI gives you too many perfect numbers, be highly suspicious. Also, if it claims a drug has 100% efficacy across all patients, huge red flag. It likely entirely missed the vulnerable populations that were excluded from the trial. Watch out if it starts highlighting secondary endpoints as if they were the primary outcome. And always check for fake or missing digital object identifiers, or DOIs.
Okay, bringing it all together now. Section 5, the 40-minute AI workflow. This is where you achieve ultimate mastery. Here is the exact 5-step process. First, spend just 5 minutes doing a summary sweep, using a tool like Consensus to group your positive, negative, and inconclusive papers. Second, human involvement comes in. You identify the top 5 to 8 absolute must-read papers. Third, you upload those into a tool like Elicit or NotebookLM to deep read the methodology and extract all that tabular data. Fourth, you validate the AI's output. And fifth, you apply your own clinical synthesis. Believe it or not, this whole shebang can realistically be done in just 40 minutes. Let's zoom in on step 4 for a second, because this is your ultimate safeguard against AI hallucinations and methodological bias. Always verify at least 3 key numbers from the AI summary against the original paper. Look at the primary endpoint result, check the sample size, and maybe verify the follow-up duration. If those 3 numbers match the source document perfectly, you can generally trust the rest of the synthesis. But if they don't, you need to abandon that AI summary immediately. And as we synthesize all this incredible information, we absolutely must remember what AI cannot do. AI is a fantastic filter for speed and structure, but it is not an authority. It can't detect subtle selection biases. It definitely cannot judge if a surrogate endpoint is actually clinically meaningful in the real world. It certainly doesn't know if the trial population reflects the specific, unique patient sitting in your local clinic. And most importantly, it cannot take clinical responsibility for a patient's care. That intellectual ownership always rests entirely with you, the doctor. Which brings us to our final thought for this explainer. AI can read the data at lightning speed, sure, but only you know the patient. By using these tools, you are freeing up your valuable time to become a more focused, critically thinking clinician. You're no longer drowning in data, you are surfing it. So, how will you use your 40 minutes? Thank you so much for joining me, and I really hope this empowers you to master the medical literature like never before.